Hello, everyone. Welcome back to the Physical Therapy Lecture Series. This is part 9, and we're beginning with the title of Exercise for Chronic Pain. Let's begin. So on slide 63, we're looking at what is the best exercise for chronic pain? Is there something out there that's the best, right? Is yoga the best, or is Tai Chi the best, or is Feldenkrais, or somatics, or gyrotonics, or Ashtanga yoga versus Anusara yoga versus Iyengar yoga or whatever. Um, and really, what we found through a lot of research is that there might be some differences in short-term outcomes with these different approaches. But in the long run, after we're talking 6 months to a year, 2 years, they all start to look the same. And the commonality is that as long as we are moving our bodies in a way that's comfortable, that's therapeutic, that feels good and is consistent and persistent over time, that's the best movement medicine. So we want to really think very carefully, as we're saying here, about fads or trends or marketing techniques that proclaim some kind of system to be the best. And the other thing is there's no one size fits all exercise for chronic pain. So it's not like, this is the best system for everyone, right? Everybody's different. But again, the commonalities are consistency on a day-to-day, week-to-week basis and persisting with that over time. And the other component is that it's progressed over time, or we call that actually graded exercise or graded exposure, all right? Or exercise movements that are progressed over time. So again, regularity, consistency, and progression over time. And as we go to this next slide, we're looking at, of course, the more this program is specific to your needs, is designed around you, the better, right? So that might be on a mechanical level. We're looking and as a PT or an OT, we're evaluating you and we're specifically checking out what is tight on you, what's weak, right? What's uncoordinated, what's in balance, where is there a loss of motor control or sensory awareness, and so on and so forth. And not only what is unique to you on a biomechanical or neurophysiological level, but also what's fun for you, right? What what is meaning for you, or what fits in your life? And that's also something that's specific to your needs, as we're saying up here. So it's not just objectively what is your body coming in to us with, and what are we seeing as we examine you, right? But also, well, what makes you unique? What are your interests? How do you like to exercise? Do you like to go on walks in nature? Do you like exercise classes, right? Maybe some people really love Nia, or they love Zumba, they love dance classes. Well, great. That's wonderful. Let's find a way to get you back into that, but comfortably. All right? And that's the tricky part. That's what we're really good at as therapists, is we're movement experts, right? We can find out where you are, where you want to go, and how to get you there in a streamlined process. Now, that might not be in a matter of weeks. That might take months or maybe even years sometimes. But with a good plan of action and something that's well thought out and well executed, we can definitely do that. So we want to be consistent, and with our program, we want to establish good movement habits, as we're saying here. And as I mentioned, that research suggests the most important factor to successful pain management is consistent movement and exercise. Again, the best outcomes are people who can get into a movement program on a day-to-day, week-to-week basis and sustain it over time. Uh, the best effects are with that, In fact, even better if you can just do a few things, a couple times a week, 2, 3 times a week for a year, as opposed to doing things 5, 6, 7 times a week for only a few months. And that's interesting when you think about it. And that's different research that we've looked at. So we want to really make a plan. And this is where PT and OT is going to help you with this, especially occupational therapy, in terms of creating that time pie and creating a regular schedule. When are you going to wake up and do your walking? When are you going to do your exercise? When are you going to do your Tai Chi? And having that plan set up and consistent times a day where you're going to do things, and it becomes a habit. That takes the body resistance away, or at least it lessens the body resistance, right? Because your body gets used to the habit, and it's easier just to kind of go in and do it. Less barriers. So then we also want to decrease the logistical barriers, right, which we're talking about, by establishing these regular times of the day, but also getting equipment that we need set up in the environment. Your yoga mat, blocks, resistive bands. It's all set up in your environment. You got a nice, cozy or comfortable environment. It doesn't have to be a room. It could just be even a portion of a room where you have all of your equipment, your own little exercise space. It's like it's kind of devoted to you. And again, our goal is that exercise should feel good. I even almost hesitate to use the word exercise. These are Our body needs movement. Movement is great medicine for the body. It nourishes the muscles, the joints, the ligaments in so many ways. It's amazing. So our bodies need this. They crave it, whether we're in pain or not. So we want to get to that place where you know, we're moving because it feels good. We like it. We want to do it. And of course, the first few months when you're doing it, it might be hard to have those effects, to feel those effects. But eventually, you will have those, and that'll be self-reinforcing. Right? The more you do it, it'll get easier. You'll feel more of the effects, the benefits. Your body will start to enjoy it, and then it's self-reinforcing. But again, initially it's kind of hard starting out, and breaking through these barriers and some of the resistances that come up. So as we go about a movement program, or just any activity in general, so whether it's exercise, activity, or any movement, we found through research that people generally fall into one of two different kinds of behavioral patterns. And these are just behavioral patterns that are just kind of it's part of the course of being human, right? If you're in pain, we might lean one way or the other with these next two diagrams. So this cycle is called the avoidance cycle, or the avoidance pattern. We can see it over here. Graph one, avoiding pain pattern. So the dotted line represents the point at which a person would experience pain when you're doing an activity. All right, so that's this dotted line. The colored pink line here is, say, an activity, and we'll just use walking as an example. So let's say I've got lower back pain that's been going on for a while, and I'm walking here. I've had back pain for, let's say, 6 months or a year, and whenever I walk, I experience back pain. Say this would be around 15 minutes here. So I'm walking, and at around the 15-minute mark, I experience some pain. Well, then I stop, and then the next, let's say, and that if I repeat that pattern over time, every time when I experience pain at the 15-minute mark, I stop, or I start to avoid that altogether. In reality, right? Like, well, I don't know if my pain starts at 15 minutes. Well, I don't want to experience that, so I'll walk for 14 minutes, right, or 13 minutes. I'm avoiding the pain. Well, then over time, if we're doing that, if we're always avoiding the pain experience, our pain threshold decreases and our body deconditions. So then, maybe a few weeks or a month later, we're noticing, well, gosh, now I can't even walk 15 minutes. My pain starts, my pain starts at 13 minutes, right? The pain threshold kind of backs up or lowers based on how we've kind of avoided or backed away from that activity. So this could again be not just walking; it could be biking, it could be standing tolerance, sitting tolerance. If we're and the exercises, and it just illustrates how if we're always avoiding pain and doing less and less activity to avoid that pain threshold, then over time our system, our body deconditions, our tissues decondition, and that pain onset's going to kind of follow it, right? We get even a little more sensitive to pain, right? Or the pain threshold lowers, however you want to term that. So the next slide talks about the other end of the spectrum. So we call this the trying to beat pain out, or the boom bust cycle pattern. And again, as I talk about this, you guys might recognize one or both of these patterns in your own life, and that's something for you to ponder and think about. So in this example, let's say, again, I'm walking, and whenever I walk, yeah, my pain starts to come around 15 minutes. But you know what? I'm just going to push through it. I'm just going to beat it. I'm going to push through it. I'm just going to do it. I'm just going to do it. To heck with this pain, right? And I go way past my threshold, because to heck with it. I got stuff to do today, right? I've got things to accomplish, and maybe this time I'll just push through it and I'll beat it. I'll force it down, right? You get my drift. Well, that doesn't quite work so well as we've learned. And you guys might be able to relate to this, where then all of a sudden, you crash, right? So you push through, you push way past that pain threshold of the dotted line, way past it, but you get a pain flare and you bust, you crash. Well, and then what happens? You get incapacitated and we get laid up in bed several days, maybe even a week, right? And after a while, you kind of build yourself back up again, mentally, physically, and you're like, all right, well, I got things to do now. I'm behind a whole week, and I got to go to the grocery store. I got to go work. I got to get this done. I got that project. I've got kids, and da da da. And then again, that could be just a cumulative thing of how you're approaching your day, or it could just be with a particular activity. It could be just with walking. Well, the heck with it, I'm gonna try walking again. I'm gonna walk past that threshold. I'm gonna beat this thing. Or maybe it's with your exercises, right? Maybe it's with your whole exercise program. Well, you're not minding the pain threshold. You're pushing past that threshold every time with each exercise. You're going way past that pain, right? It could be any one of these circumstances. So you're working through it. You're not really being mindful of it. You're not working with it. You're just going way past it, and same thing happens. You get a pain flare, and whammo, and you get laid up. So you can see the consequence over time is really the same thing as the avoidance cycles. We decondition. If you're getting constant pain flare-ups and constant, micro-inflammatory cycles, you're irritating things, your muscles are going in more spasm, your body is starting to complain at you and grumble, right? Because it's feeling beat up. And you're just creating more, this muscle spasm and tightness, and you're losing kind of proper movement patterns, and you're getting laid up a lot. Well, yeah, your body atrophies, it deconditions, and it's the same result, as with the avoidance cycle. And of course, the pain threshold lowers as your sensitivity increases, right? The body becomes less trusting. So maybe you can relate to one of those, maybe not, or both of them. But here is one of the cycles of chronic pain, and we could add a lot more into this, but this is a general cycle that is kind of involved in these two behavioral patterns that we look at, or we just mentioned. So when you're in pain, whether it's chronic pain or pain that's produced from a flare-up, well, of course, there's going to be more muscle tension, right? Muscles tense up, they guard up, they armor you up as a natural protective mechanism, try to protect you. It's a natural protective mechanism, right? Guard up, protect the body. There's more threats. And with muscle tension, right? Well, joints are going to tense up too. Joints lock up. There's altered movement with all this tension. Things can't move. They can't move as well and as smoothly. And when there's more muscle tension and joint tension, the body's more tensed, it alters movement. And of course, on a circulation level, things get reduced. There's not as much blood flow. So not as much nutrients are going in to the area to provide nutrition, right? And good things. And of course, there's not as much outflow of the bad stuff. So good things can't get in and bad stuff can't get out. There's a backup, right? Things are so tight, normal metabolic byproducts or nasty inflammatory chemicals like we're seeing down here from irritation and overdoing it or underdoing it. Those are kind of locked into the muscles and the joints and sensitive areas, and they start to accumulate around nerve endings and cause more irritation around nerve endings, which even further increases pain. And then we go up here and reduces movement even more. So we've got, muscle tension, joint locking, guarding patterns, altered movement patterns, reduced circulation, increased inflammation, right? Well, what does all that lead to? Pain, right? More pain and loss of sleep, more mental emotional stress we could add in here, right? And of course, with more mental emotional stress and altered sleep patterns, we get more pain, which produces more muscle tension, and we just go round and round. Now, this isn't meant to depress you. I don't intend for that, but hopefully this helps to illuminate the cycle, this vicious cycle, this chronic pain cycle. This is just one cycle that can be happening when you're in pain, and hopefully validate that, yes, this is a rough experience when you're going through persistent pain patterns. And and hopefully it starts to make sense, and bring things together for you in a bigger picture of how things relate, and the complex nature of pain, and why we attack this pain from a multidisciplinary, interdisciplinary standpoint, from all different angles, right? To address all the components as best we can, because again, pain isn't just a muscle problem. This is a multifactorial, multi-system issue that affects the entirety of us in our life, and we want to respect that. I mean, this is a tough thing, but at the same time, there is hope, there is help. You can move out of this. That's why we're here. We've been doing this for a long time, and we have strategies to help you with this. So again, hopefully that gives you hope, and not hopelessness. And as I'm talking about this, remember, we have psychologists on staff too. If this triggers things in you, emotions, if it creates any upset, please talk to one of our psychologists. That's what they're here for. Or talk to me about this. But we've got a lot of people. We've got a lot of people on staff, counselors as well, to help you with these things. Because certainly this can bring up a lot of stuff. So as we were talking about going back to again, the best exercise approach. Well, yes, there is no best exercise, but we have found, as I mentioned, again, the consistency, the regularity, the persistence, and this graded progressive approach. It's not an exercise type per se. It's not like a fad. It's not a named or branded approach. But what this is, this does work well with pain. This is just an idea of how we progress movements over time. So this graded exercise approach, which I'm going to illustrate to you right now and talk about, it does work really well. It's not branded, but it's just kind of like a logical, systematic way of starting from point A and moving to point Z. And recognizing that it does take time to move through these persistent pain patterns. So here's what this looks like. Let's say this red line is the onset of pain with an activity, and we're going to use walking again as an example. And walking is going to be this green line. So let's say, again, I have lower back pain, and I'm walking, and when I walk at about that 15-minute mark is when I begin to experience pain. That's the red line. So about 15 minutes, I begin to experience pain. Well, what I'm going to do here, this is the correct kind of approach to movement or activities. I'm gonna walk 15 minutes, maybe even 15 and a half minutes. I'm going to push into that point of discomfort, not too far past it, or maybe just up to it, maybe 15 minutes, maybe 15 and a half minutes, right? And then I stop and I take a break for the rest of the day, right? And the next time I do it, same thing. I kind of go up to that, I walk again, I go up to that point of where I experience a little bit of discomfort, maybe around 15 minutes, 15 and a half minutes. We know from research that it's okay to experience a little bit of discomfort. In fact, sometimes it might even be advantageous. I think that generally speaking, as long as we're not completely avoiding pain nor pushing way past it, either one is fine. Again, going to it or just a little bit past it's fine, just not too far past it. But we do the same thing again, right? And we do this over time. We're walking to that 15 and a half minute mark where I'm feeling a little discomfort. I do this for a week or 2 weeks. We call this nudging, kind of teasing the edge, teasing the barrier. And then over time, we do this for a week or 2 weeks, or even a few days, we notice, oh, well, now the pain onsets later. My body's conditioned. The nervous system has desensitized. The threat mechanism is lowered, right? My neuroimmune system isn't as overreactive, right? It's calmed down a little bit. And so now the threshold's at 16 minutes. So now I can walk, like week 2 or week 3, I can walk 16 and a half minutes, 17 minutes. And I work that for a week or 2 weeks or whatever, right? or maybe a couple days. We generally say, you try to increase 30 seconds every few days with an activity as a general rule of thumb. But you get my drift here, that this approach is, we call this, being the tortoise, not the hare, right? Slow and steady wins the race. And you work something for a little while, you're very mindful with this, but over time, you can see that you slowly will get more body conditioning and less pain sensitivity. And this can be with walking, it can be with sitting, it can be with standing, it can be with an exercise. Um, but this approach, this slow graded exercise approach, gives the body time to acclimate. We're avoiding the avoidance cycle, and we're also avoiding the boom bust cycles. So this is not so much about pain, but more about, yeah, maybe you're going to feel a little sore, because that's normal when you're exercising and getting adapted to different activities. So we say, oh yeah, you might be feeling sore, but you're safe. Little reminders along the way that you can use as little mantras to yourself. Oh, I'm sore, but I'm safe. I'm doing okay. There's no damage, right? I'm hurting. I have a little bit of hurt, a little bit, right? But I'm not harming myself. Those little reminders, those inner mantras, can be very helpful. I'm pacing it, I'm not racing it, right? Pace it, don't race it. Be the tortoise, not the hare. Things like that. All right, so this is the correct approach to movement. Again, it can apply to any exercise, activity, or approach to movement in your life. And this is the way to go, that beats out the avoidance pattern and the boom bust cycles. Those just don't ever work. And if you don't believe me, keep trying it. I mean, don't, but you can. It just won't work out. So graded exercise is like building a callus. We've all had calluses on our feet or our hands, right? And what does that mean? Well, yeah, the more you work it, you build some extra tissue there, right? It gets tolerant to that activity. That's like graded exercise. So slow progressive increases in activity will improve tissue tolerance. It will thicken up tissues. It will, we're going to talk more about that later. It's going to build the cellular architecture in muscles and ligaments and tendons and joints and cartilage and discs. It truly does that. That's called mechanotherapy. And again, that's going to be our next topic of conversation. But you're building calluses in your body, whether you see it or not. That's what's happening. So we say, go to that edge, go to your edge, find your barrier of where pain just begins, and touch it, tease it, nudge that barrier, and that pain threshold will move over time. Don't go too far past it, nor do you want to stay too shy, shy away from it. So remember, you can be sore but safe. You can feel a little hurt, but remind yourself you're not harming yourself. We don't encourage a lot of pain, but again, the research says it's actually okay to experience a little bit of pain as long as you're not causing a lot of hyperreactivity in the alarm system where you're creating a pain flare, and things are really blowing up on you. That's not beneficial. So it's okay. So that's what we mentioned here. It's okay to experience a bit of pain, as long as you're really no worse than that night or the next day. That's the true indicator. If you're not feeling any major consequence that night or the next day, that's okay. That's acceptable. That means that whatever you experienced as far as like some discomfort, that's okay. That's not going to have a major impact on the body in terms of causing a pain flare and getting you caught up in one of these vicious pain cycles. So on a general level, this helps to essentially reprogram the pain signature. This helps to change body-based pain memories, right? Or pain patterns, neurological patterns into healthier ones. That's very complex, these two bullet points here. And if you want more information on that, I can give you references. Again, this is like, two bullet points to describe something that we could really talk for hours about. And there are textbooks written on that. But hopefully that's at least to illuminate kind of what's happening. This is just beyond muscle strengthening. We are working deep neurological patterns. This is neuroplasticity, bioplasticity we're talking about, right? We are rewiring the system. And because essentially it's still operating, again here, it's still operating on this level of thinking it's being helpful for you. It still thinks when there's pain, it's helping you. It's being overprotective. Well, it doesn't think it's being overprotective. It is overprotective, and it thinks that it's being helpful to protect you from a perceived threat, whether that's real or perceived, or whether it's in present time or reacting to something in past time. There is this extra sensitive neuroimmune alarm system, essentially, right? And that's what we're finding in research. It's not even just a neurological element. There's a neuroimmune element to this. Um, and you could almost liken it maybe to an allergy. And I mean, that's kind of what we're looking at here in research is it's oops, it's again, it's this extra sensitive alarm system. So pain does not equal tissue injury all the time. I think you guys know that at this point, but I think it's worth saying again that just because we're experiencing pain does not always equate to tissue injury. It could, especially with an acute pain onset, right? That's obvious. But with chronic persistent pain patterns, it might not always be. In fact, it often isn't. So this last bullet point here is just a reminder that it takes a lot of repetitions, thousands of repetitions, and they really say we found that it takes between 6 to 10,000 repetitions per movement to create a more permanent neurological change and movement pattern change and muscle pattern change with that movement. So per movement. So this is I hope this helps to give you comfort in the idea that maybe you're like, well, that's why PT hasn't worked in the past, because well, I didn't do it long, I haven't done it long enough. I only did things for a couple months. Well, yeah, it takes a long time, right? And maybe that helps to explain that and give you a fresh perspective on movement therapy and how it's set up. I mean, you have to have the right expectations for it, right? Without the right expectations, then you're going to shoot yourself in the foot. Now, on the other hand, this might be very discouraging for some of you. You might feel, are you kidding me? This is going to take me that long, and I've got to do that much work to feel a change. Now, don't get me wrong, this isn't to say that you're not going to begin to feel differences from the get-go. I mean, I think a lot of you are going to start to feel pain relief, in this program or soon thereafter. But we're talking to really create more permanent changes and deeper, long-lasting changes. It takes a lot of time and repetitions. So if you're feeling discouraged with this, if this is bringing up any feelings of hopelessness or any emotions, again, please remember, talk to our counselors, our psychologists. That's what they're here for, to help you work through some of these things that are brought up as you're kind of pondering and working through this information and as it relates to you and your life. A couple more things. So as you're working with this exercise approach, this graded exercise approach or graded exposure, you got to know how to progress it over time, right? You have to know how to progress it and how to regress or modify the exercise. So this is a little simple graph we put together to help you with that. Let's say you start an exercise with 1 or 2 sets of 10. Well, one way to progress it is, you graduate from the program and you want it, this is getting easier. You can build it from 2 sets to 3 sets, right? You can also build those repetitions beyond 10 reps to increase endurance. You can go from 10 reps to 11, 12 reps, 13 reps, right? You can also expand the range of movement that you're doing the exercise with. So let's say you're starting with a real small range of movement. Well, you can go to a kind of a mid-range and then build into a nice full expansive range of movement with the exercise. You can also work on increasing coordination and control, right? Getting better body control, refining the movement quality with it. You can also increase your connection to the sensations, right? As you're moving, you're kind of getting the movement pattern down. Well, yeah, what am I really feeling and sensing with this activity? What's coming up in my awareness? What what type of sensations am I experiencing? And of course, that's all about body awareness. And eventually, maybe with some exercises, you can add a weight or resistive band, like a TheraBand. It depends. So these are all different ways that you can evolve and exercise over time. You should never be just doing 3 sets of 10 for infinity. I mean, maybe just to maintain once you're at a maintenance level, but if you really want to gain function back in your life, if you want to make gains, we have to be progressive. Again, that graded approach, we have to be progressive with our exercises. So different variables that you can work with, think about those. We can talk more about it. This is also why we say to people, when you graduate from the program, maybe you come back in a few months, right? Once you've worked through things are more comfortable, you want to come back for a program upgrade in 2, 3, 4 months, come on back for a few sessions, and we'll be happy to help you with that transition to the next stage. Now, what do you do when pain is high? What do you do when you're in a flare-up? Well, it's the same thing, but the reverse, right? Pain is high, we generally say with your pain flare plan, which is in your packet of information. When your pain's high, just general rule of thumb, decrease everything by 50%, right? Decrease 50%. Duration or time of the activity, sets, reps, we can go down a list here. Just decrease it all. So that might mean if you're doing 3 sets, you go to 2 or 1 set. If you're doing 10 reps, go back to 5, right? Maybe add a rest between each repetition, right? You can decrease your range of movement. So yeah, just shorten it up a little bit, make it smaller and more manageable. Decrease your total time of the activity. If you're normally walking 20 minutes, just do 10 minutes that day. But at least you're still doing something so your body doesn't decondition. And of course, you can use a lot more breathing and imagery between sets or between exercises to help calm down the body, relax the nervous system, give the blood and lymph and fluids a chance to replenish into the joints and tissues and muscles and nerves, right? Doing more relaxation as opposed to activity when your pain is high and you're in a pain flare. So knowing these variables is really, really important to be able to modify your program accordingly. When do you progress? When do you regress? When do you push forward? When do you maintain? And when do you pull back? Really, really important. And these principles are important whether you're in pain or you're not in pain, whether you're a high-level athlete or you're a beginner. It doesn't matter. You have to incorporate these basics. I also want to point out that the rest periods between exercises or in between sets of exercises is just as important as the exercise itself. We often forget that. We think we have a lot of emphasis on the doing part, right? Do, move, more. But this rest period is just as important, right? Like in yoga and traditional yoga, and hatha yoga, they talk about not just the asanas that you're doing, but the rest breaks between these asanas or uh, postures or exercises. So you move a little bit and then you rest in shavasana or the corpse pose or the relaxation pose. And hence, and they've been doing that for thousands of years, right? Hence why in our program, even though we don't call it yoga, just yes, we've got relaxation therapies and maneuvers because it's important. So yes, you should be doing your relaxation exercises as an exercise in and of themselves, but you could also incorporate those between exercises in your PT or between sets. So you do a little movement and then you do some breathing for a couple, 2, 3, 4, 5 breaths, and or use some imagery. And that's going to help blood and nutrients return to the tissues. That's going to help your nervous system to calm down and re-regulate, not get too overly sensitized. This is a great chance to practice changing the pain signature, right? So you remember when we talked about working that homunculus of the brain, and the more we can sharpen those brain body maps through imagery and imagining movements the way you want them to move, seeing them happening more comfortably and easily, that changes these neural network patterns, along with diaphragmatic breathing and other things as well. So thank you again for this lecture. We're going to conclude with that and pick it up next time with the tissue conditioning. Thank you so much for your time. I hope that was helpful. Talk to you soon.